All right, this is a keyword before we start this lecture, so to be familiar with, I would like you to get familiar with the CDS. It stands for Color Doppler Sonography, the CCTA, Color Comet Tail Artifact. The others are self-explanatory, and that should be easy for you to understand that. So let's move on to the next slide. Now, why do we need color Doppler? This is a question we all ask ourselves about. Basically, to identify the direction of flow, to help us identify abnormalities not anticipated by the use of grayscale imaging, and also to aid us in our decision-making strategies when procedures like biopsies or drainages are requested by clinicians. The other important point is you need to prevent disastrous outcomes when abnormal vascular structures are mistaken for abscesses or other masses. Color Doppler sonography must be included with all of your abdominal imaging studies. So this is a slide showing the flow direction that we appreciate on an image. We see the grayscale in the background. We see the overlay of the color Doppler, and we can see in the bottom of the slide the spectral wave Doppler. So we have the combination of all three in the same view or the same image. Now, what color Doppler implies? You have your color saturations, you have your color maps, you have the velocity and the Doppler shift. We're not going to get into details into the physics of their concepts, but the understanding of the basic principles is important for the purposes of this lecture. Now, color Doppler versus spectral Doppler. When you look at spectral Doppler, it's a small region sampled many times. We're using about 30 to 256 samples per display line, versus color Doppler where you're using fewer samples, 816 per display line, and mean frequency shift display. Now, based on what we're getting, we're trying to get something called the Doppler shift, which is the frequency shift. This phenomenon is observed when sound is reflected from a moving target. Now, the next slide is we're going to discuss the factor influencing Doppler shift. These are very important factors that you need to consider while you are optimizing your color Doppler. The first one is frequency of the sound used. The other one is the angle of the scan, and the last one is the velocity of flowing blood, the RBCs. Now, frequency, what are you going to use? You're going to use high, or you're going to use low. The concept is you need to understand the advantages of each of the two. Now, higher frequency results in greater frequency shifts. It's a more robust flow imaging. But remember, you can't use higher frequency all the time because you're limited by the sound attenuation that will affect the penetration. Now, we have two examples. We have one slide on the right side. We have another slide on the left side of the screen. And watch, at 7 megahertz, I'm scanning this mass in the liver, and you can see the bulk of the vascularity identified is in the superficial component of the mass. Now, the same patient, same plane, I'm using a lower frequency, 4 megahertz probe, and you can see that I see more color Doppler in the center of the mass and in the deepest components of the mass. The other component that is important to us is the angle, the effects of the change in the angles or the angle of inclination. So lower scan angle will give you the best or the highest Doppler shift. The optimal angle is 0 degree. And the lower the angle, the better the signal, and the higher the angle, the less or worse the signal. Now remember, at 90 degrees, you're not going to get any signal or Doppler shift. Now, if you look at this slide, you can see the hepatic veins nicely identified by color Doppler, particularly the middle and the left. And if you look at the right hepatic vein, you would see there's no blood flow. So you don't want to jump to the conclusion that there is a clot in this vein. First, you need to think, I need to change my angle to be able to say whether there is a clot or not. So we go ahead on the next slide. We change our acoustic window, and as you can see, we can see a very nice right hepatic vein filling with color, and there is no evidence of clot or any abnormality in this vein. Now we move to velocity measurements. Higher frequency shift will correlate with faster blood flow velocity. It's good at showing relative velocities within a given field of view. But you have to keep in mind, it is not a good measure of the actual velocity. Again, using color Doppler, you may get confused about some patterns of blood flow. The reason why is that is because we're limited by the construction of the probe, by the curvature of the probe itself and design. So the angle of flow is going to vary across the image. The color images or changes with angle to flow will give you different blood flow. Look at this example. The splenic vein is coming all the way to the level of the pancreas, and you can see at the midline of the transducer the flow pattern changes from going towards the probe to going away from the probe. This is normal accepted variation, and you have to be familiar with that. Now we get to the most important element of this talk, is how we get the best of our color Doppler on any machine. So in other words, we need to optimize our color Doppler. Achieving the best color Doppler image is synonymous with tuning a musical instrument. You need to tune the instrument to enjoy the sound produced by that instrument. If you do it right, you will get the information you need and help solve problems. On the other hand, if you don't do it right, you will get confused, you will make erroneous diagnoses, or may miss an important one. So optimizing a color Doppler starts with an initial setup. The first, you're going to look at parameters and how we're going to adjust them. All these parameters exist on all machines on the market today. So the first parameter is acoustic axis. All right, this is the easiest way to do. Just if you can't see what you're looking for, change the area from which you're accessing the organ of interest, and you can improve that by optimizing the image, the color flow in the image. The other thing is frequency. As we said, choose high versus low based on what you're looking at. Closer to the surface, deeper to the surface, and also consider the limitations of how far the organ of interest is far from the surface. Next parameter is scan angle. Make sure you have the lowest angle possible to achieve the best results. The next parameter is color gain. Set this at the noise floor level. The focal zone depth, the area of interest. Make sure your focal zone depth are always at the same level of the area or the structure of interest that you need to identify or interrogate with color Doppler. Power output, the maximum allowable by the machine that you can get. Now, beyond that initial step, you need to go and fine-tune your machine, fine-tune your color Doppler settings. This starts with the wall filter adjustments, decrease, so that you can allow more RBCs or red blood cells to come through the system to be sampled. The scale, decrease the scale, you will get more blood flow or more color signal. The color priority, this thing is very tough to tell you how to optimize, but the thing is, many of the machines nowadays are like built-in modality that you cannot change much, and it is part of the manufacturer's preset parameters. The sample volume size, increasing this volume size also helps you to get better flow in the area of interest. The color box width, decrease the color box width. This helps you to get the best out of what you're looking at. Specifically, it will improve your frame rate. Frame averaging, increase frame averaging. Again, adjust accordingly. Make sure you don't have any color bleed, and make sure that the vessel of interest that you want to interrogate is filled with color confined to its lumen.